September is Pharmacy Month, and this year's theme is Women and Health. As a young woman myself, I'm honored to be interviewing Lieutenant Colonel Precious Ngayana, who is the acting SSO for pharmacy at one military hospital. What are the key elements that pharmacy entails and brings into healthcare?
As pharmacists, we are a bridge between doctors and patients. So a lot, it's not about just dispensing and giving medication to the patient. We review and analyze the medication that the doctor has prescribed based on the diagnosis that the doctor has given for the patient. And then if there is anything that we are unsure or doubtful of, then we would call the doctor. And one of the process is to give patient counseling. So we need to take time and engage with our patient to understand that they know how to take the medication correctly, because that's how you then ensure compliance, because things like hypertension and diabetes, they are very prominent and they are easy to treat, but you find that the patients don't actually take their medication correctly, and some they will take because they are not well. As soon as they recover, they think that they have recovered, like cured. No, you cannot cure those. The treatment is for life. So the pharmacy has a role and responsibility to make sure that the patient understands that. Thank you.
Has there been any ways on how to improve the pharmacy department at the hospital?
Yes, currently we're working on ways to courier medicines to our patients. Currently we have the VPA courier service, which is limited to the members of the VPA fund, but we've realized that you find a lot of people who are stable on their chronic medication. They don't need to come to one military hospital for their medication, but they end up coming here because we don't have a courier services for non-VPA members. And also going forward, we do try and encourage you. You find that, you see, our patients are very old. With age comes a lot of diseases, and our patients, they go to multiple departments because they have different kinds of diseases. So what you find with many scripts, you find that there's duplication of therapy. So our members may be taking medications together that they shouldn't be taking. So moving forward, we will be encouraging patients to just come with one consolidated prescription to the pharmacy. It's also to limit the wastage in terms of issuing too many items to one patient. Some of them end up not being used, and then that's very costly. And also to improve their safety, because whatever you take, it has to be metabolized. Your body must process it and excrete it, and the more medication you take, some of them they fight inside your body, and some have undesirable impact on your kidneys, for example. So that's what we're trying to do to improve services and the health outcomes of our patients.
How do you keep your knowledge up to date with current pharmacy trends and new drugs?
I'm academically inclined, and I'm very much interested in the clinical work. So I'm forever engaged with the universities, with conference organizers. I've just come from Belgium in Brussels, where I was presenting in the Congress for International Council of Military Medicine. I had 3 presentations there on 3 different categories, mainly ethics, and then also on improving polypharmacy. Polypharmacy is one of my passions, where I try and encourage patients not to take too many medications, and also encourage the doctors to limit the number of medications that they write for their patients, because you may suffer from everything, but you don't have to treat some of the illnesses. You have to prioritize which ones are most important and then treat that, because if you take drugs for life, they do have side effects. Actually, they can lead to they can do more harm than good if they're too much.
This is Sio Lekwareng reporting live from one military hospital.
Health Warriors, serving the brave.